Hi, my name is Stephanie, and this is my checkoff for the cleansing enema. I'm going to assess the patient for the need for the enema, we'll check the doctor's orders, introduce myself, two forms of verification for the patient. I am going to educate the patient on what I'm going to be doing and make sure that the patient understands. I'm going to gather my supplies and close the curtain for privacy. I'm going to assess the patient's abdomen, and I'm going to wash my hands and don some gloves. I'm going to raise the level of the bed to a position that is most comfortable for me, raising the left side rail, lowering the right side rail. I'm going to assist the patient in the left sideline Sims position. I'm going to raise the right knee flexed. I'm going to use a waterproof pad to cover the patient, only exposing the rectum. For the cleansing enema, I'm going to gather me a bucket. I'm going to identify the temperature of the water, which the water should be warm. I'm going to make sure that 750 to 1,000 milliliters of water. I'm going to prime the tubing of the enema and clamp it off. After that, I'm going to lubricate the tip of the rectal tubing, lubricate it, insert it 3 to 4 inches upwards towards the umbilicus. Then I'm going to have the buckets at sideline hip level, raising the enema. If the patient complains of any abdominal pains, raising the enema 12 to 18 inches above the rectum. If the patient complains of any abdominal pains, I'm going to lower it down, ask the patient to take deep breaths. Then I'm going to raise the the bucket back up until all of the solution has been has emptied, or as much as the patient can withstand. I'm going to ask the patient to hold the fluid at least for five, 5 to 10 minutes, and then I'm going to clean the patient up. I'm going to raise the level of the bed and raise the rails up and lower the bed to the lowest position. Give the patient the call lights. Observe the catheter for the stool solution, and do all my documentation, which how the patient tolerated it, what procedure that I did, the solution that I used, the results, and notify the physician.